haven't been on here for a while. I just wanted to give an update of my being a CNA while in nursing school. Sorry, I'm a little slow. I just got out of work, hence why I'm a little ragged. I'm not CNA, actually. I'm also a waitress. But being a CNA, I think, was one of the best things that I could have done. I know a lot of people in my class started being CNAs, and honestly, after starting to be a CNA, I don't see how people go straight out of nursing school with absolutely no experience. I think it is the best experience to really apply yourself and really put yourself at the basics and looking for all the little things in the patient, because as a nursing student, we're so quick to think of the whole patient and the diagnosis and the medications. Yet as a CNA, you're switching your thinking into all the other little things that are so important, such as, turning the patient, for it's not just for their skin, it's for their lungs too, it's just a whole other world thinking as a CNA, and I think it's been the most helpful thing to me. And you also learn a lot. I know on my floor, even though it's apparently an ACE unit, acute care for the elderly, I've had shifts where, none of my patients were over 65, just because, we're such a well-rounded, med-surg unit. So I think it's been really helpful, and I would recommend it to anybody who's in nursing school. In fact, I suggest it. And if you are not sure if you want to even go into nursing or whatnot, I do recommend you do the course, become a CNA. I know my school, they gave us our CNA credentials through our hours, through clinicals, so I think that's a good option, obviously, if you know you want to go into nursing. But if you're not too sure, I would suggest being a CNA first. It's not, a lot of people think nursing is glamorous, and it's really not. It's so far from that, and luckily I started off in another field in healthcare, and I decided that I wanted to go into nursing instead. I was going towards being a dietitian, and I'm very glad I switched, but I mean, there's people who switch from nursing to dietetics, so, and it all comes down to who you are and if you know what you want. But nursing is great. I am excited. I graduate in May. Like I said, I would not take away my CNA experience, and I'm only per diem. I'm only been a CNA for 6 months per diem, so in context, that's not too much experience at all, actually. But it's cool because as you learn more in nursing, you learn more in your classes about different diagnoses, and then I go to work as a CNA. I really try to look at the whole picture. I start to just piece together everything that I learned in school, and then everything that my role is as a CNA, and I think it's so cool. So I would recommend it. My dog's coming in, sorry. I would definitely recommend it. I think it's great for your experience and opportunities, and hopefully get your foot in the door somewhere. That's why I did it. It's, not the best paying job, but that's why I'm still working as a waitress. I'm working 2 jobs and going to school full time. But I wouldn't trade it for anything. I think it's great, and I've gotten to know a lot of people, a lot of awesome people. So if anyone has any questions for me, I know I'm terrible at this. I've just been so busy. I'm going to try to maybe do another update soon, probably sooner than 6 months, hopefully this time. But if anyone has a question, look how old this. Sorry, I just noticed this. 2006. This is an old sweatshirt. It's ragged. This is what I come home and change into. Sorry, I went off topic. But if you have any questions, leave a message in the comments, whatever, and I'll hopefully back to you. All right, thanks, guys. Bye.